So early on in my pharmacy career, I was looking for solutions that would help nurses in long-term care facilities actually be able to provide a more secure and sound medication administration at the bedside. So I ended up documenting all the miscommunications, all the errors related between pharmacy, pharmacists, and nursing and long-term care facility, and tried to really come up with a concept that would help patients, receive the right meds at the right time. We wanted to build a software for our pharmacy that would actually integrate into pharmacy management software, whereby we would tell the automation what to package. It would then provide a handshake to us and basically let us know that what we wanted to put into a pouch of medication for a dosing time for a single patient was in there. We captured all of that information electronically. So we went and actually created a virtual inventory tracking system where pharmacies can send an order into our high volume centralized hub, where again, we package, run through the process, vision checking, ship back to the pharmacies. We are integrated into something called a build to ship to concept, where pharmacies actually order medications from their distribution partner. Those medications are shipped into our high volume hubs, and we package the pharmacy's medication and we track their on-hand inventory precisely. And we track lot number, expiration date, quantities right to the patient in real time. So basically bulletproofing the delivery of medication.
I distinctly remember reading this New York Times article that came out maybe 6, 7, 8 years ago that basically directly pointed at us at the time and said that pharmacists today are not part of the care loop. If you could enable the pharmacists to be much more integrated in care delivery, it would be wonderful for the healthcare system. And I think if you remember, Shane, from that point on to now, we are working very, very hard to fulfill that mission. Ideally, the way things are going, I think everybody is realizing the best place to provide care is in a patient's home. The challenge, however, always is providing care at home is expensive. Our goal is to drive and provide that care cost effectively so that it is scalable, so that it is not only meant for the very sick people or the very rich people, but pretty much across the entire spectrum of population in North America. Amazon at the time was just taking off in e-commerce and were beginning to offer AWS for the data centers. And our thought process at the time was, can we do the same kind of experience for all the pharmacy owners who cannot invest in automation?
Once we cracked that nut on how to deploy just simple packaging to community pharmacies to help them, we both realized, I remember we had the conversation, we looked at each other and said, we're just scratching the surface of what we should be doing here. Because once you figured out how to work with community pharmacies, right, the next step, the next evolution was, now we can scale into the patient home.
I think is going to be essential. I think the pieces that we are bringing together, whether it is automation hubs plastered around North America, whether it is our horizontal capacity of clinical pharmacists providing that oversight, whether it is the pieces of technology that are making them very, very productive and effective so that they can multiplex their knowledge across hundreds and thousands of patients who are being served on the platform, absolutely is going to help address our cost of capital, because our unit economics of delivery of care to each and every patient is absolutely going to be much better than anybody else out there.
We truly believe that we're doing something that nobody else is doing.